Hello, my name's Jill Bailey and I work with Helen Sanderson Associates. We're making this film for the Alzheimer's Society to share with you how we're using person-centred practices to support people who are living with dementia. We're looking at what people affected by dementia have said they want to see in their lives and how person-centred practices can help. The Dementia Action Alliance is made up of over 250 organisations committed to transforming the quality of life of people living with dementia. And it comprises of organisations that have signed the National Dementia Declaration. The declaration identifies the challenge dementia represents to the UK and outlines outcomes that range from ensuring people with dementia have choice and control over their lives to feeling a valued part of family, community and civic life, including people living with dementia having personal choice and control or influence over decisions which affect them. The key statements from the declaration are shown here on this graphic. This graphic shows how person-centred practices can help to deliver what people affected by dementia have said that they want to see in their lives, as is described in the National Dementia Declaration. I want to share what we're learning with and from people living with dementia by sharing some of their stories. The first statement that we're going to look at is choice and control. There are 4 person-centred practices that can help with this, so let's start with the one-page profile. Louisa is a fun-loving, sociable 70-year-old who's described as so generous she'd give you her last penny. She's recently been diagnosed with Lewy body dementia. She lives in her own home, which she shared with her husband Bill for many years until his death a year ago. A very independent woman, Louisa was a head teacher in a secondary school until her retirement 9 years ago. Her memories become increasingly impaired, so her son and daughter call regularly to support her at home, and this is supplemented with calls 4 times each day from a home care service. This is Louisa's one-page profile. Personalisation starts with the person knowing who they are, what matters to them and how they want to be supported. A one-page profile, therefore, is the foundation of personalisation. Without this information, people are likely to be treated as a clinical condition and the dementia will always be seen first. Louisa and her Admiral nurse Bernie thought about what made a good day for Louisa and what made a bad day. Her good days included seeing friends at the luncheon club, her family and the carers she knows well, suggesting that those things are very important to her. On her bad days, she feels reliant on others and that her life is in the hands of others, suggesting that to support her well is to help her do things rather than taking over and leaving her feeling disempowered. Bernie and Louisa used this information to build her one-page profile. So the one-page profile is a summary of what matters to someone and goes beyond simple likes and dislikes to identify the key preferences and unique attributes that make the person who they are. Staff supporting Louisa as their job description to ensure that the things that matter to her are present, and so is Louisa supported consistently in a way that makes sense to her, even when a number of people are involved in providing that support. So the one-page profile is about making sure a person's day-to-day experience is how they want it to be. Louisa and Bernie also began to think about the decisions that Louisa was keen to make for herself in order to support Louisa to have personal choice and control or influence over decisions affecting her. This is the decision-making agreement, which identifies the decisions that the person makes or wants to make and how others can support the person. Knowing how someone communicates is essential, yet we need to do more to support people to have choice and control over their lives. This reflects moving from person-centred care to personalisation. Self-directed support means enabling people to make choices and decisions about how they want to be supported so that they are in control of the support that they receive. Louisa's family were concerned about a number of things. Louisa was struggling to swallow, investigations haven't revealed any medical reason, and anxiety is suspected at this point. Louisa hates to puree her food, and she doesn't like to use a straw and a lid on a beaker to drink. So that was one of the decisions that Louisa thought through. As you can see on the decision-making agreement there, she talked it through with a GP and a dietitian. And the final decision is made by Louisa, depending upon the advice that she's been given from the health professionals. Another concern for the family was that Louisa was sleeping in the recliner chair downstairs because she was afraid of going upstairs and going into her bed. Again, the physiotherapist was involved and spoke with Louisa. Louisa's aware of any problems that may arise as a result of sleeping regularly on the recliner, but it's Louisa's decision that that's what she's going to do for now. The family are also concerned that if Louisa goes out to the shops on her own, she may not find a way home. Louisa's talked this through with her son and her daughter, and Louisa's decision right now is that she will continue to go to the shops until she doesn't feel that she's able to manage that. We can use the decision-making agreement to figure out how much choice and control someone has in their life now, and the next question must be, what can we do to increase it? This can mean looking at the decision-making agreement and asking, what would it take for the person to have more control in the important decisions in their life? What other decisions would the person like to have more control over? The actions and decisions that resulted from exploring these questions with Louisa were that her children, Joanne and Michael, will talk through situations with Louisa as they arise, as this really supports Louisa to feel more confident in decision making. Jill and Louisa are using the Living Well document at Louisa's request to help her to think about living well in the now and to think and plan around her end of life wishes. Louisa and her Admiral nurse Bernie are going to develop a sheet exploring how best to support Louisa to be involved in all decision making and who else to involve in which decisions. The Mental Capacity Act and personalisation share core values. The MCA says that a person should make their own decisions, and where this isn't possible because they lack the mental capacity to do so, that they should play as big a role as possible in decision-making processes that directly affect them. The decision-making agreement can be really helpful here. This is Doris. She lives at home in Lancashire with her daughter Joanne and 3 teenage granddaughters. Described as a real live wire, Doris always has a ready smile and will go out of her way to offer help to others. Joanne thought that she was pretty good at best guessing what many of Doris's behaviours meant, such as when Doris was putting her hands in other people's pockets. Joanne knew that Doris was actually looking for some lollipops which she loves and always keeps in her pocket. But she became puzzled by some of the things that Doris was doing. The family decided to really pay attention to Doris's life story to see if that might provide clues to explain some of Doris's actions, because as a family they were feeling less and less connected with her. Joanne explained that her real fear was that her mum would become isolated in her own bubble and drift further and further away from them unless they learned more about this and were able to step into mum's reality. Friends and neighbours who had known Doris in her younger years had a crucial part to play in building this portrait of a story. They were able to tell Joanne that Doris had turned to her Roman Catholic faith during the war years and had been a devout worshipper between 1943 and 1949. Joanne was born in 1959, so had never known her mum as a practising Catholic. This helped them work out what some of Doris's actions meant, and this is described in the communication chart. So, for example, if Doris lays newspapers or magazines on the breakfast bar and makes a cross on her lips, what we think it means is she's delivering the gospel reading at the altar. What we should do in response is sit quietly with her until she's finished. If Doris covers the teapot or something similar with a handkerchief, what we think it means is that she's thinking of Mass and the Eucharist. What we should do in response is go through the book of minutes that she kept from the church meetings while listening to one of her CDs of favourite hymns. Old friends also described how troubled Doris had been about running out of items during rationing in the war years. That made Joanne think that her mum's reality right now was those war and post years, as it explained why Doris was stocking up on so many items. She would often go out and buy lots and lots of AA batteries, bananas, bathroom cleaner, and what Joanne realised that meant was that Doris is fearful the shops are running out of stock. And what we should do in response is reassure her that we have plenty of food and everything that we need in the cupboards. Joanne describes her relief. We could get closer to Mum simply by stepping into the bubble which is her reality with her, and making sure that she doesn't drift further and further away from us by becoming more aware of the things that she was telling us. There are still some things that we don't get, but we are trying constantly to learn more rather than just giving up. Linking this back to the National Dementia Declaration, knowing how people are communicating supports their personal choice and control or influence over decisions about them. This is the reviews graphic, and linking this back to the National Dementia Declaration, it supports people's choice and control or influence over decisions about them. So this is what we call the person-centred review process. What we know is that collecting person-centred information and not doing anything with it is wrong. So we learn how people want to live and be supported by discovering what's important to them and how best to support them from their perspective, and record that on the one-page profile. But we must then consider if those things are present or absent for the person by using what's working and what's not working. Central to personalisation is moving from knowing to acting on information about what's important to a person, how they want to be supported, and how much control they have in their life. If we don't look at what's working and not working, we simply create good paper instead of working with people to enable them to live good lives. Exploring what's working and not working serves as a bridge between what's been learned about what matters to the person and how to support them well, and action planning. A person-centred review brings together people who are providing support from different roles or places. With family and friends, it places the person who's been supported firmly at the centre, even if they no longer use words to speak or communicate typically. So a person-centred review is a person-centred approach to the annual reviews that are required in all services. This is Mary, now in her 80s. She took up a career as a nurse, training as a midwife and a theatre sister. She's described as salt of the earth, a stickler for good manners, etiquette, and she has a strong work ethic. Mary was diagnosed with Alzheimer's in her mid-70s. She's lived for the last 3 years in an extra care housing scheme, and she also attends their day service. Her condition deteriorated significantly after a fall in June 2012, followed by a 3-month stay in hospital. After a hard-fought battle with continuing healthcare funders, discharge planners, clinical and social work staff, who all deemed Mary was best placed in a nursing home, Mary returned to her own home in October 2012. This was made possible by the belief of the family and the support team that the best outcome for Mary was to return to her home, to be supported by people who knew her and who would ensure those things that mattered to her were present in her life and that she was supported in a way that worked for her. Mary's social worker used the person-centred review process to explore what needs to happen to make sure that what's working in Mary's life keeps happening, what needs to happen to change what's not working for Mary, and to think together about how we can address any issues that we're struggling with. What can we do together to enable Mary to move towards her in the future? At this stage, a typical review would involve social workers and professionals reading their reports and considering all the things that go with that. However, in a person-centred review, the person shares their own perspective, and then everyone else, including family and friends, adds their views and information is shared and built together. Mary's story shows how important it is to have rich information about what's important to a person and how best to support them from their perspective, and to ensure that information is acted upon and kept live. The person-centred review process was a quick way to update all of that information and to make sure that people were listening to and acting on what was working and not working for Mary. Mary's daughter Jenny describes the person-centred review meeting. "What makes the difference is that it starts and ends with Mum," said Jenny. "Everyone's contribution mattered and each contribution was given equal importance. It felt okay to share problems, but also to work together to reach solutions. It was like an event rather than a formal review. We had fun together, getting to know more about Mum. Running the review in this way gave everyone the opportunity to see my mum as a real person who's lived a full and varied life. Mum really enjoyed having people in her home with tea and cakes, and she was able to contribute on her terms. She enjoyed hearing what people appreciated about her. I could see her physically grow with pride. I liked the way all the information was able to be used to update her one-page profile." This is John, a former businessman who ran his own company for many, many years and travelled the world. People living with dementia like Ken have also said that they want a sense of belonging and of being a valued part of family, community and civic life. So how can person-centred practices help? Let me share John's story with you. Developing a community map is a great way to look at what's out there in the person's local community and explore with the person where their interests lie. John's one-page profile records that it's important to him to go out and about and that he loves walking in the garden, he loves fresh flowers, black coffee with biscuits every day. John's family and staff decided to explore local places that John might be interested in. They created a community map of a 6-mile radius around where John lives, looking for opportunities and places that reflected what was important to him, or places that he might be interested in visiting. They decided to try the local garden centre, as walking in the garden and flowers are important to John, the engineering museum, John had run an engineering business, coffee in the local cafe, perhaps John could enjoy his black coffee and biscuits there and become a regular. Jane and Gemma, his 2 daughters, and support staff from the home care service drew up a plan for 4 months to support John to go to these 3 places. They also used learning logs, another person-centred practice that we can use to record our daily notes for each visit to reflect on how this had gone. And they then took the learning from the learning logs around what are the things that had worked well that we want to continue, and what are the things that had not worked so well that we needed to do differently. Once you know what the person's interested in and what's available in the local community, the next step's to start making connections. This is Fong. Fong lives at home with her husband Tony and is supported by an Admiral nurse, Lorna. The highlight of Fong's day is David calling in each tea time on his way home from work. We were thinking about how we could find new ways to connect Fong so that she could take up a valued role and make a real contribution within her local community. She'd always been very much at the centre of her local community. So we decided to use one of the person-centred practices that can help with this, which is called presence to contribution. Presence to contribution is a person-centred practice that can help us look at connections and contribution. This links to what people are telling us they want in the declaration in terms of I have a sense of belonging and of being a valued part of family, community and civic life. And it helps people work out what it would take to go from simply turning up to an activity and being present to making a contribution. Lorna's an Admiral nurse supporting Fong, who has dementia, and her husband Tony. Tony wants to continue to support Fong to live at home, but he acknowledges that he needs some time to himself. So Fong began to attend a day centre 2 days each week, but this really didn't work for her, and she would return home distressed. This placed Tony under even more pressure as he tried to reassure and settle her. Lorna, familiar with person-centred practices from her previous work, talked with Tony and his son David, asking them to think creatively with her about the options the community had to offer. Fong had always been a keen rambler and was described as one of the most jovial people you could wish to meet. She just loved the company of others. They thought about Fong's gifts, her ability to connect and converse with others shone out. So they thought about situations where Fong could make her best contribution. They needed a local place which Fong would enjoy going to, and also where the characteristics, social rules and roles of the group would offer options that had worked for Fong and promote her inclusion. So they were thinking about something that would give Fong the opportunity to participate and contribute, as well as giving Tony a much needed break. Their favoured option was the local gym, which had a walking group from 10 a.m. till 12 noon on 3 days each week. Lorna used the Presence to Contribution Person Centre tool, and it was a huge success. This helped Lorna and Tony think about what needed to happen to support Fong to move from just being present in the group to fully feeling part of the walking group and making a contribution. Fong made new friends, and though initially her son David went along with her, she soon became a popular member of the group because of her zest for life, and David now drops her off at the gym at 9:45 a.m. to meet her friends and calls for her after lunch 3 days each week. It's something Fong thoroughly enjoys. She's a valued member of the group. She appears to have a renewed sense of purpose and self-worth. She takes some cakes along to share with the other members of the group when they have a cup of tea after they've been out for the walk. And Tony gets a chance to have some time to himself. So we've looked at the community map and the Presence to Contribution person-centred practices. Another of the things that can help in terms of people having a sense of belonging and of being a valued part of community and civic life is the relationship circle. This helps us understand who's in the person's life and how these relationships can be supported. Meet Olive. Olive's a lady who lives in a sheltered housing scheme. She's spent many years as a housekeeper before retiring 20 years ago. She was diagnosed with a dementia 10 years ago and is supported by home care support each morning and evening and goes to a day service 5 days a week. One of Olive's friends is a head teacher at the local school and is on Olive's relationship map. So after conversations with Lily, the headmistress at the school, to think about what it would take to support Olive to volunteer at the school, ideally perhaps serving the tea and toast to the children in the reception classes, Lily said that she'd have a chat with some of her mutual friends and they would think about who was free to perhaps support Olive to go down to the school 1 or 2 mornings each week. Molly said that she'd be happy to spend a morning a week with Olive at the school, as it'd be such a good match for Olive's skills and interests. It would mean that Olive could help with the washing up as well and spend time with the children. Lily and Molly felt that it was a real joy to see Olive's skills being used where they were valued instead of them being seen as irritating. And also a happiness at being around children was really evident. Olive's now supported a further 2 mornings each week by Sue, who's a dementia friend in the local area, and everybody who knows Olive would say how dramatically her well-being has increased since she's been spending her mornings in the schools. Now let's look at another area people affected by dementia have said that they want to see in their lives, and that is that they have support that helps them live the life. This is Louisa, so I wanted to share some of Louisa's story with you. She has a diagnosis of dementia and lives at home supported by her husband Ivor, but family support has its limits and the level of support Louisa needed was ever increasing. Ivor started the process by requesting a social care assessment, and they found themselves in a world that many occupy, Ivor trying his best to support his wife and at the same time trying to navigate the health and social care system that can sometimes be less than easy. So Ivor needed a break if Louisa was to continue living at home, and a social worker arranged to carry out an assessment. So what was decided was that Louisa would use 2 days per week in a daycare provided in a residential home. Now, given that Louisa would follow her husband about all the time while they were at home, or that she'd go outdoors and walk and walk and walk, if you think this through from the perspective of Louisa, this is quite a curious solution. That is to separate her from him for hours on end in a place that's got locked doors so she couldn't get outdoors, and expect that she's going to fare well with that. So what happened then, unsurprisingly, is she's very distressed, she's agitated, she won't engage, she's desperate to leave the home where the day service is being provided, and that spirals into violence. Ivor asked if the social worker could think further about what would work for Louisa, because clearly going to the day service in the residential setting wasn't working. So what happened was the social worker came along and began to think very differently and acknowledged that we can't decide on outcomes to be achieved without doing that in the context of what's important to somebody and knowing how best to support the person from their perspective, because that's information that we need to ensure that a person's support is tailored to their needs and aspirations, and that's the very bedrock of personalisation. Day service didn't achieve Louisa's outcome, so they developed Louisa's one-page profile together, and this is what the social worker arranged instead. They found a small local agency that Louisa and Ivor were happy with after meeting with them and making clear Louisa's requirements. These included having a team of no more than 3 people supporting Louisa from the agency, and they needed to understand and agree key ways of providing support. So the arrangements were put into place and started to work well. So Louisa went to the Crown Green Bowling Club with support from one of the identified workers one afternoon each week. She was supported in her home or to go out walking by the same provider on another afternoon each week. She was supported to join a time bank and contributed 2 hours a week ironing, which is something that she really enjoyed and was extremely good at. She then took back 2 hours and was supported by another time bank member who'd sit and read to Louisa. She shopped at Tesco, supported by a dementia friend one afternoon a week, and they also went into the cafe and had a cup of tea together. They're also exploring how assistive technology may help. Louisa has a buddy system so that if she does go out, Ivor can find her quickly. So Louisa and her family found this a creative and flexible approach to providing a support, and this was also ensuring that those providing support knew what good support looked like, and of course the recording in the one-page profile would certainly help with that. So we're talking about helping people to have a normal way of living the life that perhaps gives somebody a reason for being alive, and really moving away from care plan boxes that may focus on a person's physical needs without also paying good attention to learning what matters to people.